Hello there, and a warm welcome to Women Speaking here on Civic Space TV. My name is Judith Atim. Pleasure to have you join us. I am excited to actually be joined in this conversation by this incredible three ladies with these amazing smiles. And of course, they're joining me to discuss the perspectives of women on the right to access to health services for AIDS patients. Bearing in mind that World AIDS Day was commemorated just on the 1st of December. And as you all know, it is always aimed to create awareness, to round the world and all the people in the world to actually join hands and eradicate HIV. And this time around, the focus is of course on centering the conversation around HIV on the rights, using the lens of human rights to actually get this scourge out of the world by 2030. Let me now introduce to you my guests. Starting from my immediate left is this amazing young lady, Fancy Sheila Aromarach. Sheila is a feminist lawyer.
Yes, I am.
Good. Hello, Sheila.
Hi, Judith.
You prefer Fancy or Sheila?
Fancy.
Okay. Hi, Fancy.
Hi, Judith.
Good to have you on the show.
Pleasure to be here.
I am looking forward to learning a lot from you and to hearing your experiences, especially in line with what you do and how you're impacting women. Good to have you.
Thank you.
I am also pleased to have with me this amazing mentor of young girls, Trassyleen Ankunda. Trassyleen is the team leader of Girls Mentorship, and you do a lot of work with young girls.
Yes.
How are you, Tracy?
I'm okay, Judith. I'm very happy and excited to be back on this show and to listen from my fellow panelists. Yeah.
Well, young trailblazing women, you just have to watch out for these girls. Last but not least, of course, I have with me Miss Winfred Mugambwa, who is the executive director of rightsforher.org. She's also an ecofeminist, and I'm interested in knowing what you do as an ecofeminist. Good afternoon and welcome to the show.
Thank you so much. I'm happy to be here once again, and always a pleasure. I appreciate Civic Space and CCG for the opportunity given to the women, empowering women's voices, having women speak their mind. Thank you so much.
Thank you, Winfred.
Yes.
Fancy, let's start with you. Could you just tell me briefly about the kind of work you're doing in your feminism advocacy, and also how this perhaps ties in with the conversation around HIV and rights and so on?
Yes.
Yeah.
All right. So, personal perspective. I am a lady who loves women to enjoy what life is about. So that's my feminist approach. The fact that any woman and every woman can be considered as a person is very essential. And things such as health is something that many women have been deprived of, very much. And so when it comes to the work that I do, is around advocacy, helping especially lawyers, advanced lawyers in advocacy, women in the law, helping them understand that there is a very thin line between you doing the work you do as a lawyer, but also doing advocacy for people. It's not always going to just be you stating the laws, but you coming down to the people and helping them understand how do I go about with this law? What does this law mean? What other ways can I be a good citizen, for lack of a better way to state it, in society? But really helping all kinds of groups of people get to where they need to get, but by women doing that. So that's what I do. So I lead a group of young female lawyers through mentorship and helping them advance in their legal career and helping them channel and advance, checking into the so many areas of the law, which one way or another, or at the end of the day, we'll be able to see more women get into issues of tech, lawyering particularly, but also issues of health, lawyering, coming in fast. So yeah, so when it comes to HIV, of course, we wouldn't, the time I think we get to face it as lawyers is when there's probably a case in court and it's a rape case, it's a defilement, you're like, then they send you for, you have to bring the medical report and there is this,
Evidence
that's
and so on,
exactly,
yeah.
that's when you get the feel of, so this is HIV. I think for most of the time, I don't think we have very honest conversations like people who actually work with people who are down with the rest of, community in line with things such as health. So health law it is a growing point of the law, helping lawyers or the legal space understand law and health and how do we really support people from a legal lens to do that. So yeah, that is
That's
it.
interesting. So in summary, what I pick is basically you're trying to give the law a human face,
A
and
very
human voice.
yes,
Okay,
yes.
that's essential. Because a lot of times, when you hear the law, it's such a technical thing.
True.
It's so much legal jargon,
Yes.
and ordinary people just find it hard to relate. And yet the law is for the people.
It is.
That's actually amazing. Let me move to you, Trassyleen.
Yes.
How is your mentorship going?
Uh,
And how transformative has it been so far?
so Uganda generally is a very young country with majority of the people in it as young people. And for us at Girls and Mentorship Space, we believe in empowering people even right in primary. That if someone actually grows up knowing this is what should be done, then most likely they will do it, than someone who has been exposed to very many other things, and then at the end of it all, it becomes challenging for them to cope because they didn't grow up maybe understanding that different perspective. So basically what we do is we offer mentorship programs in primary schools, secondary schools, universities, but we also do community outreaches. And as a lawyer in community outreaches, we try to break down the law for a common man to understand it outside the articles and statutes that seem to be more of a nightmare to most of the people. And we also offer public speaking advocacy, because we believe that women, if they cannot speak or represent themselves, then they will never get outside the box of the challenges that they do encounter in life. We also do career guidance in schools and also even other people in community. So basically, to put it into context with HIV, is that we are trying to also have issues of sexual reproductive health rights advocated for in these institutions, and also the large numbers of young people that we meet. For example, is it use of condoms? For example, is it access to maternity leave? For example, is it access to, is it the kind of nutrition that you're giving your child? And we equally believe that through that right to health, and also putting ahead preventive measures on how we can be able to control this, but also look into those that already are victims or already having HIV. I also do know that over time, our space is in a way that we have people who also own organizations within our spaces. We have people in the sexual reproductive health and rights. We have people in climate. We have people who are doing civic engagement. We have people who are politicians, women who are leaders. And so it gives us a wider view of how collectively we can put different information together and be able to package it so that it streamlines with the challenges that we face. Because as women, I realized that we face the same challenges. Women in Uganda, women in Congo, women in Nigeria, the challenges are not really that different from each other, but the approaches maybe could be different depending on the context of the country and its governance. So at Girls and Mentorship Space, we ensure that everyone has a voice and young people actually can have their perspective but be able to defend it and grow together as a community. Yes.
Thank you, Trassyleen. Winfred, rights for her. How is it going for you over there, and how is ecofeminism moving on?
How is it going on for us out there? Of course, like everywhere, things are challenging. You can't predict your tomorrow. you can't predict your tomorrow, given that even the content where we are working from as civil societies. Rights for Uganda is an ecofeminist women-led organization, a gender-diverse women-led organization focusing on the intersectionality, promoting the intersectionality of human rights with the main focus of women's rights, environmental sustainability, climate justice, and sexual reproductive health rights and prevention of GBV. We focus on, we believe in peace and security, and know that without we can't, if we don't look at the other, we can't achieve the peace and security we are all envisioning, we are all looking for. Yes, we focus on prevention and recovery. We have grown up, we've all when we look at ecofeminism, for us as ecofeminists, we believe that you can't separate women's rights from our environmental rights, because we all live on the planet, we all feed from the planet, we all grow from here, we do our work from here. But again, it is the women who have been the custodians of the planet. Even up to now, from the beginning up to now, it is the women who are the backbone of taking care of the planet. So we believe that what the planet is facing is what women are going through. Everything is coming from the patriarchal side of it. It's about exploitation. We are where we are because of the exploitation that happened. Yes, the planet is suffering. Yes, because of the many things. Imbalances in resources, exploitation of resources. When you go to women, it's the same exploitation, patriarchy, power over women, power over resources. So as ecofeminists, we believe that you can't say that you're fighting for the rights of women and then you're leaving out environment and climate justice. You're leaving out where you're doing your work from. So for us, we advocate as we advocate for other rights, we have to look at the imbalances that affect women and ecofeminists and women and the environment. And again, like where I told you, we focus on, we look at peace and security. We do every work we are doing. It is that we want to achieve. When we talk about ending HIV/AIDS, when we don't have peace and security, it means that more infections are going to the infections are going to raise. When we don't have peace and security, it means that the woman out there, yes, the woman who doesn't have the privilege, may even when they have the voice to speak, but maybe they don't have the platform to speak from. Yes, so that is why we focus so much on amplifying women's voices. Yes, we want to speak for, we don't believe in speaking for, yes, it's true that we can speak for the voiceless, but that is not our belief. We believe that every woman has a voice. It only takes empowerment. It only takes a hand to reach out for that woman and give them what they lack at that moment, to have that their voice put out. So we believe in empowering voices as we advance or advocate for equality and gender and for gender equality. Yeah, thank you.
Thank you, Winfred. So I'm going to just run through some quick statistics here about AIDS. According to the Uganda AIDS Commission, the national HIV prevalence in Uganda as of 2024 is estimated at 5.2. But when you look at the statistics, yes, 5.1%. Okay, that's our national prevalence. But the rates vary markedly across the country from different regions and population groups. And of course, the numbers are not really good. When you look at Fort Portal City, the prevalence in Fort Portal is 17.8%. That's a very scary number. Much higher, like almost three times almost higher than the national average, because this is due to new infections, especially among women and adolescents. When you go to Soroti in eastern Uganda, the prevalence rate is 12.5%, again more than double the national prevalence rate. In Lira, in the north, the prevalence rate is 12%. Among population groups, HIV prevalence is more than twice as high among women than among men in each 5-year age group from the ages of 15 to 34. The early adulthood prevalence increases markedly in early adulthood. So you're looking at ages 15 to 19 and then 30 to 34 years. These are not really, really good numbers. When you look at the target, the global target to end HIV by 2030, and you see these kinds of figures coming up at a time when we should actually be having figures even at the region, perhaps lower than even at the national average. What comes to your mind when you actually see this? And especially the fact that the biggest percentages are among women, and especially young women. What are your quick thoughts, Fancy?
My quick thoughts are we are misdirecting energies. We have been misdirecting energies and concerns, misdirecting resources, misdirecting efforts, and not listening to society actors like those who go at the ground level and interact with different groups of people who are actually with the people and not really the leadership. That's my quickly I would think about that, because at this point this year we're about six if my math serves me right, we're about 6 years to 2030, right?
Yeah, sure.
We are supposed to be looking into
five. This is December.
Absolutely, in December. So we're supposed to, at this point, we're supposed to be probably looking at, guys, we have done this. How can we do this better? We've been doing this, but we are still sitting here with there's still something happening. That's not right. So my quick thought is there's been misdirection of energies of different forms, financial, supporting the different actors on ground, also leaders not doing their role. We still have a big issue with the culture and understanding what actually needs to be done in terms of the stereotypes that we still have in place. So there is still a lot of, it even still probably happens, misdirection of so many things.
Resources.
Yes,
Okay.
resources and leadership in general. Quite a lot of misdirection.
Trassyleen,
Yes.
let me hear from you. When you hear these numbers, what comes to your mind first?
I think the approaches could be different, and some approaches could be the wrong approaches that we are taking. On Saturday, I was in Uganda and we're having conversations with women in the rural areas. And I remember one woman asking a question that really perturbed my mind. She said that if boys who impregnate young girls are arrested, then who do we expect to take care of the children that will be born by that girl? To me, it came from an angle of a point of that either it is the concept of feminization of poverty, or people do not look beyond what actually should be done. I know that over time in Uganda and also most of the African countries, the approach is usually either legal or moral. And for over time, moral has always been fronted over the legal aspect, or they have both been correlating, where we have forgotten the aspect of the reality. For example, if you say that women, I know the concept of women, we cannot discuss women and leave out the minority women. For example, maybe the sex workers. You know, every time we are saying this is legislation, it has been passed, and so because it has been passed is what should be followed. Even if we pass that legislation, what is the reality? The reality is that those women are still having sex and with multiple people. And because they are not protected, they cannot easily access the healthcare services. They cannot easily be heard in community. And if their issues are not addressed in the more manner that is actually appreciated in community than maybe molarity that people always front, then it is going to actually increase the number of those women because they are not accessing those facilities and services. So to me, I would think that if the approaches are really to be taken, they should not be discriminatory, because if you talk about human rights are non-discriminatory in nature. And because they are non-discriminatory in nature, they must involve everyone. We already have women. You are a woman already disadvantaged by some people in community, but you're also a woman with a disability. You know, so we have failed to really put the women within even their smaller subsets on table to understand the approaches that we can use for them to be able to amplify their voices, but also for them to be able to overcome the challenges that they do face. So I think the approaches, somewhere we miss out on a point where we feel molarity should be, or actually what is molarity and for who, you know, and why does the question of molarity show up on when it is a woman? You know, when you put up a short skirt, someone is like, no, you're not supposed to put on a short skirt. Or someone will say she was raped because she was in a short skirt, you know. So the concept of how you show up and who you are showing up for has always been really challenging, that it has left even the little efforts that we are trying to put in to ensure that we get this done. However, there is some progress, because I saw the president when he was in Rwanda yesterday saying that there's now been an injection that the scientists are actually putting in place, that instead of having those drugs maybe on a daily basis, you can take that injection and then you run for 2 months without taking any other thing and still be safe. So there is still some progress in terms of the approaches that we take, but also how and when will everyone in communities get that injection is also challenging, because if we are talk about the approaches, then we cannot fail to talk about accessibility, availability, and affordability, which over time have not co-worked together. Why we have more women now today, being the majority of them, that are suffering from AIDS and HIV, and also the fact that feminization of poverty, that women are most of them are very poor, and because they are very poor, they cannot afford a thing or two. And so what happens next, today or tomorrow, if they sleep with someone, if someone says maybe they don't want protection but they're offering them 20K, the fact that someone cannot even get 1K in a day, it is going to be easier for them to say, after all, I am looking for this 2K for my children to have supper at home. So if we can only address the idea around feminization of poverty, that can women be empowered economically? Can they be empowered financially? Can they really have something that they can do, so that it, in the way, tries to bridge away the feminization of poverty, that you can earn something, as Judith and Trassyleen.
Thank you.
Yes.
Thanks a lot. So Winfred, I think I'll still throw the same question back to you. Then I'll come back with another round of different questions. When you look at the numbers, first of all, what comes to your mind, and where do you think we've gone wrong? Is the message just not resonating with young people today, or, I mean, what do you think actually went off course?
Of course, what gets in my mind is I picture the future of the girl child. I picture the future of the woman. What is the future? How does it look like? Yes? You know, you get very many pictures of the next person after you. Or how do we even have that future? Do we have, when we say a bright future, do we even have it? When things are, if we are now talking about HIV, things are still worsening. And where did we go wrong? People are putting a lot of efforts. That is the reality.
That's a fact. Yeah.
Women-led organizations have done a lot of work. Funders have invested a lot of money. The government has put their very nice laws. Very nice laws. I'm not a lawyer, but when I hear them talk about them, I feel, yeah, as a civilian, as a citizen, I feel the laws, they are good. But where did we go wrong? You know, I'll borrow some verse in the Bible. I can't interpret it well, but in fact it shows that many people have the wisdom, but people lack understanding. And that is where we are. We have very many people who have gone to school, very many people who are learned, they have the wisdom, but they lack the understanding. And there are people seated in these positions either to implement, because there is a lot of lagging around implementation. You know, these things, there are things, you know, we all know mostly how most people get HIV. And we've heard of cases of how people have gotten HIV. And we've had perpetrator get away with it. We've had a perpetrator get away with it in front of either judge, in front of LCs, in front of police. So these are people who either have wisdom but lack understanding. We are having wrong people in positions that would help women. Very many people. So as other people, other parties, other stakeholders are putting in a lot of efforts, we have those who are busy drilling those efforts down. We must all accept that the perpetrator will always find a different uniform. Perpetrators have always been there. They've been violating women. We have seen women being raped and they contract HIV and they don't get support. We've heard of men, last time there in our village in Kayunga, a man raped an 8-year-old girl and defiled, that is defilement. And the man contracted this young girl with HIV. Infected the young girl with HIV. And you know, and parents were advised, can we have a talk? Like how she was bringing it out that one of the problems, the government has done a lot, but we are seeing economic inequality a lot. Poverty is a lot. And I believe, I'll agree with her where she said that many people go out there to look for money. Many women are out there to look for money. These days, very many men. If this government ever took account to see on men who have turned down their responsibility on children, I think the government will be very shocked. So we are having very many women now being fathers and mothers to children. We are having very many young girls taking care of their siblings, young ones. And how do they take care of them? They have to look for the money. If they are in places like in town where there are no gardens that they will go and dig to earn either 10,000 or wash people's clothes, it means they'll go and look for either do sex work. And they have no power over, they have no bargaining powers over their body. Meaning that a man who comes in with the motive of spreading HIV will use as many girls or women who lack the power to bargain to use a condom, who lack a voice to say that no to that, we didn't agree this, you know. When you listen to stories of women who are doing sex work, they're forced to go without a condom after entering the room. Then let's go to homes. We've heard of very many women share stories of how they got infected through either rape, but yet they are married. So when we talk about the economic aspect, inequality around economic, like financial inequality, where people don't have, many women have less money, where many women are living under poverty, it means that there will be an increase in the numbers. You've read these places. Most of the places are far outreach places.
But Fort Portal is likely a tourism city. So you have this influx of tourists from different parts of the country and the world heading there. So ideally, they're definitely going in with a lot of money. And like you're saying, there could be lots of vulnerable women who find it easy to fall prey to maybe exploitation and so on and so forth.
Thank you for bringing in that. Sometimes when we feel a place, you've given an example, you've said Fort Portal, there's a lot of tourism.
Yes.
But what is the level of the woman out there, empowerment level? What is the level? We might have developed the place to the tourist level. The things are there. But again, women out there, you know, sometimes when you lack some bit of knowledge, when you're ignorant, when you don't have the opportunity to get exposed, it means some things come to you and you go into them with excitement. And many times women fall prey of that because they don't know much. Not many women, we may to look at Port has many tourist places, but again, when the women there, when there are very many marginalized women there, when we have very many women there who are not educated, when we have very many women there who have not gotten the chance to go to school, when we have very many women who don't have the knowledge around, too much knowledge around HIV/AIDS, when we have very many women who don't have knowledge around prevention, very many. Sometimes we look at things and we look at either the town bit of it or the privileged women. But like how we are all agreeing that maybe sometimes very many women fall because of they need the money. Yes, maybe they have children to take care of. They have homes to take care of. They have very many other burdens to take care of. And again, about the age bit of it, we have had very many cases of young girls, even in schools. Was it this year when we had a teacher in Luwero who had infected 5 children? 5. Those ones who had spoken. You get it? But remember, when we get these ones, I can't recall the story very well, but remember, truth is later, this perpetrator got away with it. If this teacher could do that to these young 5 people, how many more people, how many more young girls did this teacher infect? Or how many other teachers, or even how many other adults who have power over these young girls are doing such to them? Because those numbers also for those young kids, it's high. It's high. So I'll go back to what I said in the beginning, power issues. Many people are getting infected because of the power issues. It could be around money. Someone has power over you around money. So you have to do what they want. Maybe because of they lack the education. Someone maybe didn't go to school because of their culture. Culture believes in girls. Some cultures, okay, we've moved some, we have some positive, we just have some positivity. But there are some cultures where girls don't go to school. The boy has to go first. And again, the other problems where we have cases where people are infected. We have people like cultural leaders. We have people like the religious leaders. I think, to me, until, of course, the debate around culture might not go well with us, but it's something we need to sit and look at, because there is a way custodians of cultures are fueling perpetrators. They are fueling things that are leading to high numbers of, so.
Well, because I think ultimately culture is still founded on patriarchy that you earlier talked about.
Yeah.
And patriarchy is basically to make the woman subservient to the male, I think. So I think what you're pretty much saying is how to dismantle some of those cultural norms that continue to perpetuate these kinds of biases and stereotypes that continue to put the woman at a disadvantage over the man. I don't know if that's what you're saying.
Yeah, it's and even that, I was saying that we need to have honest conversation. Honest, until our country accepts to have honest, because women have tried to dismantle. Very many, even with some men helping us, but that sometimes is failed. Until the country accepts to have honest conversations around cultures, around religions, where things are not going on well, we shall still be lagging behind.
Thank you.
Yeah.
So a lot of times, of course, when we talk about HIV, we look at HIV as a health issue, which it is. We look at HIV as a social issue, as an economic issue. But when you look at the theme for the World AIDS Day for 2024, it is trying to zoom in on this problem using a human rights lens. how best do you think we can recenter HIV and position it as a rights issue? And how effective then do you think this positioning of HIV as a rights issue actually contributes to lowering the numbers and eradicating the scourge by 2030, which is just a few years from now?
5 years from now.
Fancy. You go first.
Very quickly is we need every actor on the same table. We cannot do this just maybe as the women-led organizations or health workers or just government. We need legal people on board. We need mothers. We need people who lead circles to join this conversation. People who in churches, these common church leaders, our Christian, from, we need everyone on the same table, because at the end of the day, this is something that affects everyone one way or another. So for me, it would be just borrowing from what the rest have said. You find why we haven't moved, the proper mile we've failed to achieve is because there is just a few people that are taking this fight on, and the rest are just held back, wait to critique you for how far you've done or what you've not done right. The cultural leaders are waiting for you and say, you guys are being immoral. Ministry of Education will say, this is sex education. But then at the end of the day, we can't hide from the fact that we need to be able to tell people, the young, the youth, what healthy relationship means, because they're exposed. We're not going to hide away from it. So everyone needs to come on the same table, and we need to be able to understand that this is something that we are having and we can't run away from it. For me, it would be let all actors come on board. That's very critical. You come, if it's to come from a financial lens, financial arm, you come from the legal perspective, you come from the humanitarian perspective, from whatever perspective. But you need to address this as a whole, like as a community, and not just those on-spot concerned people, but everyone really needs to be on board. Yeah.
I hear you. Trassyleen, the question, Fancy touches the issue of talking to young girls, and you talk a lot with young girls. What conversations do you have in terms of creating awareness around issues like HIV and what their rights are, what their sexual and reproductive health rights are, and what do you hear from these young people?
I think the situation is very sad because most of these young girls are abused, some by their relatives, some by their own parents, and some by the neighbors, but they cannot speak about it. And even sometimes when they speak and tell you, you find you might not do much. You can do counseling, you can talk to them, but because of the power over that has been mentioned, you still get a lot of clashes. One of the things we advise or always talk about is that understanding the whole concept of human rights, that human rights are universal, no one should be denied a certain right, that human rights are interdependent. If someone is sick and they are not accessing healthcare services, most likely their right to life can be taken away. If someone is not having maybe food, most likely their right to life might be taken away. So we do encourage and talk to these young people on issues around health and safety, but also we face challenges because these are young girls who have grown up in certain cultures, and by the time someone is 13, society is already asking, why are you not married? All the girls you went with to school are married. Personally, all the people I studied with my whole primary are married right now. And if I tell them that at this age I am not married, they are wondering, what is this one doing? They start viewing you as a failure. That one has failed. She has not been able to get a man. 4 children behind people you are with in the same class. So the society contributions, and some of these men are men that have HIV and AIDS. Some of these are those that actually can never go for testing. The Act talks about going for testing. They can never go for it because, again, this is a man who has power over you. And so whatever they will do will be according to them, not according to you. And also because most of these young girls are in a society where they are told to be the good girls. You know, when a man talks, you don't repeat. You have to do what the man has said. You should never say no, you know. And all those thoughts within the minds of these young girls greatly contribute to the more cases that we have. You know, it is very challenging that I feel religion in itself has also been a tool that has been used to disempower women. And if, for example, I did interact with a certain girl from somewhere I will not mention, and she told me that there are 5 girls at home, and all of them actually got married before they were 18. So she was 16 now, and they're saying, get a man, go marry, we need cows. And usually they are not even like 1 cow, 2 cows, again, poverty. And so the pity in, you know, as a girl, you should be understanding, you know, your parents, they don't have money, they will not take care of you. Maybe the man is also telling lies how he will pay for your school fees. So they're saying, how do we sell you off than how do we actually contain and understand what you're going through? And so the girl, luckily, she did not fall into the same category. She's now studying and she's finishing her degree. But it was challenging for her because she had to fight battles until she was even taken over by a certain NGO that is paying for her. The parents were like, if you are around, if you are my girl, if you're my daughter, go, how special are you from the rest? This has been the norm. And you know, the most bad thing is that even have sisters that went, they'll be saying, yes, it is okay, come join us, you know, you're not special, eh? We were there before, we have now managed, we have grown to love the man, you know. Such thoughts in community and society are still a challenge, even when we come with the education system that we come to. But also the localization of the conversation is still a challenge. That you find you can talk about the acts, you can talk about the medicine, you can talk about everything, but if you're going to interpret all those in your local language, sometimes the information is not picked well. And what we also do is, how best do we make this conversation comfortable? Because with HIV and AIDS, mostly we are talking about sex and all those things. And someone is 13, they're having sex, but the parents are actually thinking the person is not having sex. They're saying, this one is still young. My child is still young. And I know that the role of parenting has also let us behind, because parents have not taken on that initiative. That people will grow when they are 13, someone tells them, now you have sex. If you don't have sex, you're going to pain. When you keep growing, it will be more pain for you. So make sure that you have sex when you're still young.
So some of those myths actually
the myths and stereotypes have greatly, that if you tell someone this, but because of those myths that we have failed to break, and which again are contributed to culture and patriarchy, has also been a limitation. Again, issues around culture, or for example, patriarchy, that when you get married, whether you're 13 or 14 or 17, or even Atim at your age, when you get married, the conversations that don't say no to your man in bed. And most of the times the influence of drugs, a man has gone, they've taken their alcohol, they come home drunk, or maybe they had to first pass somewhere else, they didn't use protection, they are now home. As a woman, you are told, don't tell your man to why are you even asking for protection? I am your husband, you know. But this is a man who has actually been to Sarah, to Jane, to Rose and Mary before he came to you. So if the concept of power over and the dynamics around control are not dealt with, then there is a problem. But we also have the concept of power within. I know that as women, right now the conversations we are having here, civic space, is to enhance the power within, that collectively, individually, we can say we can do something. And it starts with actually realizing that there is a problem. Because if we don't realize the problem, then we shall never find solutions. So there is a problem. The problem is HIV and AIDS. So how do civic spaces play in this? Is it this awareness that we are doing? Or is it online advocacy? Or is it actually going to those communities and telling people now, you see, you can actually have sex at 30 and there's nothing wrong. You know, it is not that when you have it, when your breasts start to come out, it doesn't mean you should go and get married, you know. It doesn't mean that you have to change your life to fit into society and the pressure that it always exerts on you. Yes, that's what I can say.
Thank you, Trassyleen. Let me come to you, Winfred. So when I hear Trassyleen speak, immediately what jumps to my mind is the fact that society has undeniably been complicit in actually holding the girl child down and also contributing to the transmission and infections of HIV. Looking at the example you gave of a teacher who actually sexually abused 5 girls in school and infected them with HIV. And earlier you talked about the need for us having an honest conversation as a society. But in having this conversation, I think how do you then actually bring together all these different actors, the religious leaders and say the cultural leaders and so on? How do we actually rally around, and because they do speak about these things, in churches, in mosques and so on, but the practice and the abuse and violation of women just continues to go unabated. At what point do we actually, well, I don't even know how to put the question, but how do we engage them beyond what society has done?
Thank you so much. Thank you for the submissions. First, I want to appreciate still on this space now. I want to appreciate the women who have boldly come out and spoken of their statuses, and they are using that to advocate. Yes, they are using that. They are talking about their stories. We even have young girls who are talking about their stories, who got the disease from either even their parents. I've seen very many who are so I want to appreciate them, and because it's not easy. It's not something easy. So when you say how do we bring all the stakeholders on the same table, it might not be easy. But let me say, let's start from there. In every community, if we have such women, such people, even if they are men, but speaking around women violations and increment of HIV amongst women, let's start from there. In every area, let's appreciate those women instead of, because in some areas, it even attracts more stigma to them. People start discriminating them. And more so if they get to know that, okay, the person who is talking about HIV is either a sex worker, and then the stigma will double and discrimination will triple, you know. If the person is a key population person, either a gender diverse person, an LGBTI person, which we fear, we shy away, and they are ready now to speak about their HIV status, and they are ready now to fight for the end, to fight the spread of HIV, to contribute to the fight. They will later not look at the cause. They will look at the person's either sexuality, the person's act, and then they will push the person away. Whenever we push people away who are ready to fight or who are ready to speak about what went on in their life, and they are ready to help another person not to fall in the trap where they fell, it means that we are adding on to the numbers. There I speak to the laws. The different discriminative laws. Even AHA itself, the Anti-Homosexuality Act. To me, I feel it's a law that is contributing to the increase of the spread of HIV amongst the gender and diverse persons. Because even the person there, because there is no difference between heterosexual life and homosexual life. Maybe the difference is around sexual acts. But when we are talking about HIV, the spread is the same. Meaning that there are people who sleep with both sexes. And if we put their laws, yes, that criminalize them, it means that we are silencing them. It means that even when they will stand up to speak about, they'll fear, because now they will try to cover up their either what they're talking about, which is helpful to the community, but again front the person's sexuality. Front the person is either, if they're sex workers, they'll say that, that one is a sex worker. They don't have to speak. But again, meaning that either you're pushing that person underground and increasing the spread. So laws that are, if we still have laws, and other parties are saying we have to have these laws which criminalize a certain group of people to around HIV, they are saying it is okay, even if HIV gets spread, forgetting that these people are sleeping with our husband or our wives or even our children. So for them it is okay, HIV can still go on as long as we have criminalized these people. But remember, we have not taken them away. They exist and they will never go away. Now, another thing, we talk about having all parties on the same table. But again, the culture leaders are saying, no, this is what the culture says. It says the man has to be, this man has to own the land because he's the man of the family. The man has to speak. The man is not supposed to be denied sex. If a wife denies you sex, you can go and get the sex somewhere else, you know. But if the woman is going to do that, they can even, it becomes more worse. The other time there is a video I watched. Of course, someone came up and told us the man was also beaten. It was still there in the north. A girl of 16 years was caught with the uncle. Uncle is above 30 or above 35. And the video we saw, the girl was being beaten. Yes, the man was also sleeping, lying down there. But this girl is below 16 years. Meaning that the uncle
should be the one to take responsibility.
Yes.
He's the adult, yes.
Yes.
Mm-hmm.
A girl of 16 years, however much they might be having big breasts, however, he's still a child. Their mind can easily be manipulated. Maybe that girl even started sex at 10 years with this uncle. And this time you've caught her after 6 years. You don't know what she has been passing through. You know, we didn't get to know about the status of the uncle. So in such cultures where girls are left to do anything, in this they told us they beat her because it was the uncle. What does it mean? If this man was not an uncle, it means it was all okay. They wouldn't have beaten the man. They wouldn't have beaten even the girl. Yes? So if we still have cultures where women are property to men, and how can we sit with such leaders? Those leaders would try to protect. Custodians of culture, I love the way they protect their culture when we go to church.
So I'm told we just have like 5 minutes to go, and I want us to wind up, but I want us to talk briefly about the right to access to healthcare in the context of HIV/AIDS. I think earlier you alluded to the issues of affordability and so on, but how can society, or how can Uganda make this access to healthcare more easier for persons with living with HIV and AIDS? Please.
All right. So for me, I think I would really not go very far away. The fact that we still hide certain things, the reality about things, would still prevent us from having honest conversations. If we still say you cannot relate with your friend, or we say this is not supposed to be done like this, we still want our children and our future to identify themselves by cultures that are detrimental to their lives, given how fast the world is really moving and how diverse the world is, then we shall not be able to achieve a right to health for everyone. So let's have these, let's be open about these things. Let's speak about these things. I mean, there's so much power, as my friends have said, in talking about these things. Just like there's so much power in calling out someone for something wrong, there's so much power in speaking the truth about something. If it's A, let it be A. Don't hide away from it. Tell these people, when you have unprotected sex, this will definitely happen. Don't hide away from it, because they actually are having unprotected sex because, well, they can't have the honest conversation. They can't approach a pharmacy and be able to buy a condom or seek medical information or even go just for testing, because then they'll judge you. I mean, why are you testing? You're 13 years. What have you been doing? So that shouldn't be the energy that we use. Let's have conversations around these things very openly, even to the youth. Yes.
Thanks, Fancy. Trassyleen.
I think that it should start from a point of where someone who has HIV or AIDS actually accepts, and they're like, it's okay. You know, sometimes it's okay not to be okay, but sometimes it's okay if something has happened, you cannot control it. If society can stop stigmatization, because when someone gets AIDS, today they feel like it's the end of it all, they are going to die like the following day. But we have seen people live longer, and we have seen other people die not because of AIDS, you know. So if you get the issue, try hard to accept one, then that will help you take your medication. Because if you don't accept, whether we preach, whether we advocate, no one is going to force you really to take the medication. But also maybe a call to the government that this should be very affordable, but also accessible. I know that we have health center 3s. Some sub-counties do have them, but the state is not the right one. They are lacking. And also, if you remember, for example, like in COVID, how it was really challenging. They're saying these are the people that should move. These are the essential workers, you know, and we are leaving out people who actually need to get medicine from those hospitals. So if we can make it accessible, now the injection that is being talked about, if maybe gladly, if it would be at everyone's disposal that is a victim, then it would help. But also, you as a victim, do not be the one that wants, you know, to infect many other people, you know. There are those who get it and they're like, now all those beautiful girls are going to see me, you know. That should never be your motive. And also, such sensitization, counseling, go for counseling where you feel it is too much. Go for counseling. Embrace that, you know, it has happened and you may not do much about it, but you can take your medication. Also,
and you can still live a productive life.
Yes,
and
yes.
Realize your potential.
Exactly. I have a friend who was Miss HIV, I think, for last year. And she's good. She's okay. She's doing well. She's achieving. She's thriving. And I'm like, oh, you know. And I have another one I got to know of recent that she's HIV positive. And she was like, yes, I am. And I'm like, oh, you actually look, you know, people think that you have lost it when you get HIV. I was like, oh, you are very healthy. She's very okay. She's good. And I'm like, so it is just about you really showing up, but also playing a role. If you are a cultural leader, don't be the one that is, you know, fronting, go and get married, go and get married, go and get married, you know.
Thank you, Trassyleen. Let me just hear from you, Winfred, your final.
The last one, go for testing, regular testing. Yes.
Okay, important. Winfred.
First, I want to recommend, to thank Ministry of Health. It has done a good job. Yes, we see the increase in number, but at least Ministry of Health, among the ministries, Ministry of Health has done a very good work. In fact, in all ministries, it is the ministry that has a law around inclusion of key population persons, and they have tried hard to go even deep. So I want to appreciate that work they're doing, and But again, she talked about accessibility. When we talk about accessibility, what do we mean? In these hospitals, are they really accessible for even disabled women? Can they access? We talk about accessibility, we talk about distance. Yes. Health Center 3, are they really accessible? No. They're accessible to those closer to that. But there are very many people in very remote areas where accessibility is difficult. So when you're talking about accessibility of SRHR services, we need to so much speak about the accessibility. And then I think they need to have refresher trainings for the service providers. Sometimes, I don't know whether the nurses are sometimes stressed or not paid, but we hear so much stigma even from the hospitals. There is that 95-95-95 strategy of Uganda, which is very good. It even talks about testing. It talks about, so if we all join our efforts and champion the 95-95 strategy, I believe we will achieve. It is all 5 years. It might not be easy to achieve what we envision. It might not be, but at least we could register. We could register positive results, other than registering increment, and say that we've done something. Yes, this has been put there, laws have been put there, but again, the numbers are high. What does it speak to that? It means that there's a lot of sexual violation increasing. Yeah. Thank you so much.
Thank you.
Yeah.
Thank you very much, Winfred and Trassyleen and you, Fancy. We've been talking about the issue of, we've been sharing women's perspectives on access to health for persons living with HIV, especially women. This is Women Speaking. My name is Judith Atim. Thank you very much for joining us, and we'll see you next time. Bye for now.